Hi Ruth, hi Vanessa. This is Homebirth South Africa, and today we have got the privilege of chatting to Midwife Vanessa de Beer, who has a homebirth practice up in Potchefstroom, and she has kindly agreed to share with us her experience being a homebirth midwife, but also a homebirthing mother to her daughter Taya, who is 6 years old. Welcome.
Thank you. So excited to be able to chat with you, something that I'm so passionate about. And yeah, I'd love to share everything that you want me to and that I have the chance to.
Yeah, thanks so much, Vanessa. So, I mean, you can tell us a bit about your sort of midwifery background, but you did the conventional South African nursing route, training in hospital. Would you like to just share with us, where that started?
Yeah, so I started studying nursing in 2009 without, I didn't want to become a midwife. That was not my plan initially. I was hoping to be a community nurse working in the clinics, serving the community. And when I finished studying our community service year that we do, I got placed in a community health center, so a CHC, a nice big clinic in Ikageng, that's just outside Potch. And it also happened to have an MOU. So I thought I was just going to be a clinic nurse, but then I ended up also attending a lot of births, and the births at the MOU looked a lot different from the births that I'd seen at a student at the hospitals. It was very, the ladies come in, a baby comes out, they relax on the bed for a bit and breastfeed, and then they go on home. It's like, oh, wow, that's nice. I didn't know birth could be so straightforward. The hospital seems to be the reason that some complications tend to happen, is what I started thinking. And then in 2014, I moved to Potch Hospital's maternity ward to work basically full-time as a midwife. And I was there for 2 years. And while I was working there, I started really doing my own research. And slowly but surely realizing that a lot of the things we've been taught at the university and a lot of the accepted practices at the hospital are actually very outdated and not only useless, but sometimes harmful to the moms and the babies. So if we had a quiet night on night shift, I wasn't one of the nurses napping or scrolling on Facebook. I was reading studies, and my mind was getting blown the whole time. Like, oh, but all these vaginal exams that we do, the research is saying that it's not a good idea to keep doing them every 2 hours, and they don't help with anything. So why do we still do them? So as I started learning all these different things from reading studies, I started implementing it at the hospital where I worked. I upset some of the doctors who thought I was experimenting on their patients. I'm like, no, the experiments are done. These are the results. It's actually better to not let women, push on their backs. Haven't you been reading? You must keep yourself up to date. And there was a different doctor who was going through the ward statistics, and she asked me, like, why don't your patients get episiotomies, and why don't they tear? I just constantly see intact perineum on your patients' stats. And I told her, well, I just allow them to push in whichever position they want, and I don't force them or coach them to push. Let them follow their body's urges, and it seems to help. It's what I read when I was doing all my research. And sorry. So that is how I started like re-educating myself. And then in mid 2015, my sister-in-law got pregnant, and she admitted to me that she's terrified of hospitals. She can't imagine anyone coming near her with a needle. She would pass out. She doesn't know how she would be able to do this. And that's when we started talking about, well, what about if I come to you? You stay at home. You don't have to enter the place of your, place of your nightmares, which was the hospital to her. And my first home birth that I attended was so peaceful, so magical. The woman, my sister-in-law, had a totally pain-free experience. She was just so relaxed, and there was nothing in any way causing her to interpret her sensations as pain. And after that experience, I just realized, like, okay, no, I want to give more women this opportunity to be able to give birth in a space where, because also I didn't actually even touch my sister-in-law. I was sitting in their lounge while she and her husband were in their room. And every now and then she'd walk past me if she went to the toilet, and she'd just say, oh, we're still fine. And then her last trip to the toilet, things started hitting into transition, and she couldn't stand up from the toilet, and she's like, oh, call my husband, I can't get up. And he helped her up, and she almost immediately started pushing. And like, it was just such an amazing experience that within a few months I had resigned working at the hospital and started my home birth practice full-time in 2016. But then I also got pregnant in 2016 with my little girl. And after I'd learned so many different things and become very comfortable with the female body, I kind of started thinking, but I don't feel like I need someone at my birth. I feel like I'm so familiar with what could happen, even though there's such a wide range of normal. Because I remember the Thursday before my daughter was born, she was born on a Saturday, my husband asked me, like, shouldn't you like give me some kind of class or something, what to expect? I was like, yeah, I guess I should tell you what to expect. And I was like, I might want you to rub my back, I might not want you to rub my back. I might make a noise, I might not. It might take long, it might not. You know, there's just so many things that could happen. And I felt I was ready for anything. And I felt very confident and in tune with my body that I would just be able to do it myself with only my husband present. And I never felt the need to have a checkup done. So I basically had an unassisted pregnancy and birth. I never had my blood pressure taken. I never did a urine test. I didn't have any ultrasounds. I just didn't feel I was in any way a candidate for medical care because I felt very healthy and I felt very in tune with my body, and that my baby was showing me all the signs that she was fine. Not that I knew that she was a girl. We suspected it, but we didn't want to expect a girl since she was a surprise, since we had no sonars. And I felt very confident. I almost want to say, like, I just knew everything was going to be fine. Like, we didn't have intricate backup plans, and if this goes wrong, this is what we have to do, and here are the emergency numbers if we need them. I guess that's also very my personality. I just take things as they come. If people try to ask me, okay, so what do we need for, you know, if we have to prepare for a home birth, I was like, oh, I guess maybe some towels, you know, that's all really. You don't need a lot of things. And there are other people who like to be much more prepared, much more, you know, like I didn't even have any, you know, like herbal tinctures on hand, like in case I bled too much. I had nothing. I was like, no, I'm just going to be fine. So I don't know if that's my instincts or if that was just, yeah, I'm not sure, but I was very just go with the flow. And her birth was lovely. I gave birth in 5 hours, which is quite nice, I would say. It's not too fast, not too long. It was much more intense than I'd expected. I must say that much at least. Especially since I'd seen a lot of women having pain-free births. I expected that for myself as well, because I really had no fear surrounding birth. But it was a much more intense experience. And if I ever have the chance to do it again, I'd love to give birth again, but I don't feel like having more children. I feel like there are a few things, yeah, there are a few things I would do differently. Make sure I eat and drink. I was very busy that day, and I'm not always very like as I am a very go with the flow person, I don't always have our meals well planned. And even now, almost 7 years later, I'm still like, on some days my husband will be like, so any idea what we're eating? I'm like, nope, no idea. So that the day I gave birth, I also hardly ate. I guess it's just because of my lack of planning.
So if I can interrupt you just for a second.
Yeah.
So I mean, in you sharing with your own birth story, sort of intentionally birthing without medical assistance, have you come across sort of any opposition or people saying, well, you're a nurse, you're a midwife, so, you know, of course it would be fine for you, but, you know, somebody who's not trained to choose that as an option is maybe reckless? What's been your experience with that?
For myself, I didn't experience much opposition. It's also very, I saw that when I was raising my daughter, whereas I feel like other women get a lot of advice from family and friends, and usually bad advice, whereas no one came to me with anything. And my mother-in-law at one stage said, people are talking about me like, when I'm with family, why don't I leave my daughter to cry when she wakes up? This little 6-month-old baby, I should leave her to cry a bit. But no one, everyone's too scared to, you know, ask me, because they know they have to come and back themselves up with research if they want to bring me some nonsense like that. So yes, with a birth, and I had my aunt who is also a nurse. She just sent me a message one day saying, just want to make sure that, you know, you're safe. Do you have backup plans in place? I told her, yeah, everything's sorted. Don't worry. But otherwise, I didn't have any opposition. But afterwards, when I shared my story, I did have one of my classmates who also was a midwife make a comment on my story saying that it's very reckless of me sharing this because I'm going to encourage other women to try to have free births. And I feel like every woman is an individual. I don't like making statements that applies to everybody. So unassisted birth is not for everybody. There are women who feel safer in a hospital, and for them I say, yes, if you feel safer there, that's where you, I guess, need to be. But unassisted birth is something that I do feel a lot of women are getting called to for some reason. Everyone has their own reasons. Very often it's financial reasons. They don't want to be at a government hospital. They can't afford a midwife. So I do get a lot of people phoning me and consulting with me about how to prepare for an unassisted birth. And one lady she came to me for an antenatal checkup with her mom. Her mom had been a doula at a different lady's birth that I supported. She was the lady's best friend, and she's like, yes, I'll be there and hold your hand and do whatever you want me to do. And then that lady's daughter got pregnant, and we had our meeting together. And eventually I shared my birth story with them. And the lady looked at me all astonished. She was like, is that legal? And I said, well, it's not illegal to give birth on your own. There's nothing, you know, stopping you. No one can say anything if you give birth and, you know, it might happen too fast and you can't get to the hospital. There's no way to make unassisted birthing illegal. And as soon as she found out that was an option, her face lit up. She's like, thank you so much for the checkup, but we won't be seeing you again. And she and her mom then handled her birth. They WhatsApp me every now and then, sent me pictures of her placenta so I can help them decide if it looks normal after her baby was out. And yeah, it was just so amazing to realize that it was something that she desperately wanted, but she thought she wasn't allowed to do it. And as soon as she heard this is actually a real option, she just kind of, I want to say, knew that that was the path that she wanted to take, with her mom and her husband present. And I'm actually, at the moment, I have another couple who want to have an unassisted birth with their second baby, who I've been talking over the phone with and helping them decipher their first birth that didn't go according to plan, and basically just helping them to get information, because you don't know what you don't know. So while I was telling them about how wonderfully a woman's body is designed, that once a baby comes out, the mom is the baby's lifeline and the baby is the mom's lifeline. Once you separate them, you're allowing risks to enter. That the mom's placenta is going to struggle to come out if the cord gets cut and the baby gets taken away. Mom might bleed much more. The baby is going to have trouble breathing and regulating his heartbeat and temperature if he's away from the mom, and especially if he didn't get all his blood from the placenta, because it's not cord blood, it's not placental blood, it's baby blood. The baby needs all that. And the poor husband, like, he was like, punching the air, like he was so disappointed that they hadn't known that, because as I'm telling him the story, he's like, yes, with her first baby, they had her on her back pushing, cut an episiotomy, and the baby was struggling to breathe, so they immediately took the baby away to resuscitate, and the placenta struggled so much to come out. And he's like, it's all the pieces are coming together now that he's getting all this information. And yeah, I feel like to give families all this knowledge and to share information with them, just it helps them to realize the way they've been treated is not right, and now they want to take things into their own hands, basically. It's also one of the themes that come up, is like, we don't want to be at the power of whoever walks into the hospital room.
I mean, you bring up a very sorry, Lana.
Go ahead, because I know you're going to say exactly what I want to say.
Well, I don't know if we are, but one thing that I thought was really interesting, what you brought up, was that thing of like, is it legal? And I think it's such an important one for people to just know that basically they can choose to birth their baby in whatever way and wherever and with whomever or without whomever they choose. And I think that's one of the things that we do want to like really make clear within Home Birth South Africa, that if you are choosing to birth at home, one of the attractions or one of the things about choosing birth at home is the fact that it makes you feel safe, and that you can then create whatever birthing environment for yourself that you want to. And you even spoke just now into the fact that for some people, a hospital birth is the safest option because it makes them feel safe. And it sounds to me like your journey through midwifery and to your own birthing experience was about honoring what made you feel safe, which is why you did it in the way that you did it. And as you say, for some people, it's like they have to tick all the boxes and know everything and, have all the information, have all the tinctures, have everything on hand. And for other people, it's almost like they don't want, because it's almost like it becomes a self-fulfilling prophecy. And I think that's the beauty of it. That's what we're, I suppose, honoring here is for people to really just tap into themselves and feel into what is right for them, and to honor that and to create that. And then the other thing that, I just want to touch on that you spoke about as well is the fact that, now I've forgotten it. Okay, Lana, you speak, then I'll remember it.
It highlighted for me this almost gatekeeping that seems to be happening, where people who do birth work want to infantilize or minimize or admonish women for standing in their power, for taking back that control. I mean, a big part of why some people do choose home birth is the disempowerment that they might have experienced, or that they're worried about experiencing if they choose to birth with a certain care provider or in a certain facility. And what's difficult for me to understand is, I don't think there's anybody who does birth work, whether it be a GP or an obstetrician or midwives working in or out of the hospital. Nobody wants bad outcomes for mothers. We don't want, we all want live mothers, want live babies. And there are many that want people to have very wholesome experiences. But I do find that there seems to be this perception that whatever service I as a birth keeper am offering, if you don't choose exactly that, I'm not comfortable with that. And so I'm going to gatekeep or disallow you access to that. So for example, if a care provider doesn't allow birthing in a certain position, birthing in the position of the mother's choice, then the relationship towards that person is cut off or disregarded in some way. And I think more people are waking up to this idea that birth is a physiological process. It's going to happen, whether you have someone's permission or not. And how do care providers like you or anybody holding a body of knowledge of birth, okay, these people are going to do it their way. What do I have to share that can be of value, that could potentially prevent an adverse outcome? I don't understand what it's very difficult for me to see care providers be so incredibly negative, particularly around free birth or home birth with support. That's just what I wanted to throw in there.
Something that is also very near to my heart is that I understand everyone's on a different journey in terms of getting back in tune with their bodies, realizing that they don't need a machine to tell them if they're fine or not. And a lot of people are softening up to the idea of a home birth, but they are still carrying a lot of their stresses and fears from believing birth is actually something that's a bit dangerous, and you should be in the hospital for just in case the worst happens. Like I did have one client who wanted a home birth, but sorry, I've got a little girl popping in here. Can't you go at the back?
I want to go up the back.
I think go at the back because I like to watch you if you're at the front.
I don't know. I want to go out.
Okay, I'm almost done and I'm gonna come help you, okay? I can't pause. Sorry. Maybe you can go up front. Okay. Sorry. So yes, I did have a client who was very stressed out about the idea of a home birth, but she knew that she didn't want to have the previous birth experience again. And the more I was speaking to her about how, the woman's body knows what to do and we need to get back in tune with our instincts, and she said, no, that's not going to work for me. I'm going to need you to tell me what to do. And you're going to have to tell me to push, and you're going to have to, she verbalized that yes, she's giving birth at home, but no, I'm not the kind of person who's going to listen to my instincts at all. And so basically, I like to meet people where they're at and provide as much or as little guidance, care, advice as they need. And very often then in the moment, their bodies will, her body did push, her body did take over, but she did look at me with wide eyes like, I'm pushing, is that okay? It's like, yes, it's okay. But just to be there, not push people too far if they're not ready for that. So if I do have a very stressed out lady who does want a home birth, I'm going to show up even more. And some people might even want me to wear a uniform with epaulets, whereas I usually pitch up in very comfy clothes at a home birth, but other people might feel like, no, but I want to see that you are a medical, person. Don't come here looking like you're one of my friends. So I do feel very comfortable in adjusting how I practice to what each person needs, because I know each family is unique, each woman's journey is unique, and so I don't mind. I've had some people who phone me from the first contraction and they want me to be there as soon as they think something is happening, and I've had some women beg me to do an internal exam because that's what they're used to. They're used to being told, you are so many centimeters, now you are allowed to do this. And then I'll, in the moment, try to explain, but an internal exam is not going to tell us the future. You know, we can trust your body, but here and there, I have done internal exams for women who tell me, but I need to know, because all my previous births, I have been told, you are so many centimeters, now this is what's next. So I'm not gonna turn anyone away or refuse to help if it's not what I like or what I'm used to. I'm much more willing to accommodate people, to help them have the best experience possible. So I've told ladies, like, I'll be there for you from your first contraction if you need me to, or if you just want to phone me afterwards and say the baby's out, if you feel like coming over, you can pop by. You know, I'm comfortable either way. I had one friend who had an unassisted birth outside Potch on a farm, and about an hour after the baby was born, I didn't even know she was in labor. She didn't let me know at all. Her husband phoned saying, it's been an hour and the placenta doesn't want to come out. What can we do? And I was just about to start talking to him, and he's like, oh, don't worry, it's out. And he put the phone down in my ear, you know? So it's such a wide range of journeys. And I feel like something that also popped into my mind is I've had a lot more women who are classified as high risk, who would be seen as, no, there's no way you could have a home birth because of all your history that's disqualifying you. But these are women who do their own risk benefit assessments and like, yes, I'm aware of this risk, I'm aware of that, and I'm aware of the risks that I have in the hospital, and I still choose this path. And I feel like there needs to be a lot more respect for those women, because they get treated very badly, as in, how could you be so irresponsible if you have all, you know, these risks, health risks, you know, previous C-sections. I had one lady who struggled with diabetes and high blood pressure during pregnancy, and walked a very close journey with her to help her keep her blood sugar and blood pressure under safe, you know, in safe levels. And she had an amazing home birth after 2 C-sections as well. But she was adamant. She knows what the risks are. She has educated herself. She knows what her different options are, and she still believes this is the best path to take. Yeah.
Thanks. I feel that that highlights such an important reason why a lot of families do choose birth at home, because the hospital, you know, if they have any of those high risk labels, whatever they may be, their path is already set out for them. They're told, like, no, you don't have option A, it's only this. Where and women, the concept of informed refusal, I think, is so foreign, because I mean, we barely have a handle on informed consent. So how, you know, so that brings me to the question of what is the challenge for you as a midwife working in this way, supporting in the way that you do? Does that look very different to what your peers are offering, and, you know, in the community that you serve? Because I imagine Potchefstroom looks very, you know, the families might be very different to the families that we serve here in Cape Town.
Yeah, I would say the challenge is maybe feeling like I'm very alone, not much support. The clients that I take, if I for some reason have to be sick or you know, incapacitated for whatever reason, there's no other backup midwife who would be like, oh yes, I'll be there to, you know, support your clients, because I also am very flexible as people need for, you know, financial challenges. So I can't you know, I can't go on holiday, or like I have this one very sad story where I was on call for a lady's birth, and my grandmother was having her 80th birthday, and I couldn't attend because the birth was 40 minutes that way, and my grandmother lived 2 hours that way. And the lady did end up having a very, very quick birth, which was under an hour in total. And so I missed my grandmother's birthday party, and she then also passed away within 2 weeks. So I felt, and like the birth didn't happen when it was my grandmother's birthday. I just knew like, oh, but I can't leave this area in case I miss that birth. But now I can't have a midwife, a different midwife saying, yes, I'll back you up, because either I've made a different payment arrangement, the people, you know, we might agree on a trade, or we might agree on a payment plan that other midwives are not comfortable with. And like you also mentioned, the high risks, there aren't many midwives who would be willing to help ladies who choose to birth outside of the hospital, even though it goes against many policies and guidelines and recommendations. So I'd say the main challenge is feeling very like I'm out here on my own, with very little support, or yeah, basically I would say that is one thing. So carrying a big burden in a way. And yeah, then also it would be great to have the hospitals be more receptive and supportive. So that is something that I do want to challenge. I want to try to have meetings with doctors and talk to them about the ethics, like you mentioned, the informed refusal. There are women who are informing themselves. We need to, the medical system needs to evolve with the times. Women are accessing so much information. They're getting involved in communities where if they don't get the support here, they're going to get the support online. And if they reach out to me for assistance, I'm not going to turn them away and say no because you don't meet certain requirements. I'm not going to help you. But we all know that it is much more safer to have an intact referral system where if somebody needs help for whatever reason, to be able to be accepted at a hospital and treated like a human. I would say that is the two main things on my mind that would be, I would call challenges. Yeah.
Thanks.
Yeah,
for
so
that.
it sounds, I mean, it sounds like a lot of the, it's almost like we often get pushed into situations which that is the same, like it's kind of like the lesser of the two. I don't want to say the lesser of the two evils, but it's kind of like what I'm hearing you speak about is like like there's still work to be done in terms of actually making the whole picture actually safe, and ideally there would be bridges crossing between the two worlds. So empowering the people to make the right choices to birth wherever and with whomever they want, and for the systems that are in place to be able to support that and honor that properly.
Yes.
And not demonize it. Yeah.
Is there anything else that you want to just share in closing about for you the best things about homebirth?
The thing that I really love is for women to have options, to not feel like they're, you know, being forced into a specific direction, that they can evaluate each, you know, scenario, look at each different situation and choose an option that they feel is best for them and for their baby and for their family. So I feel like limited options is really, it's something that takes away from, how can I say, like it's a big disrespect to women to say, no, you're not allowed to do that, or because of these reasons, that's not an option for you. The more options, the better. And to respect women for the decisions they make, to realize that they're an autonomous human being who can think for themselves, and then to honor the decisions that they make. So I would say that's what I love about homebirth is women being able and making choices for themselves and their families that they feel work best for them, so that they can, I almost want to say, they play such a big role in creating the experience that they want, whereas a lot of women do feel like they're at the mercy of others when they go to a hospital, for example. But in no way saying that a hospital should not be an option. Options are good. We need as many options as possible. So a safe home birth, a planned unassisted birth, everything should be, you know, laid out, respected, and women should be taken seriously when they start thinking outside of the mainstream ideas, not seen as irresponsible or uncaring towards their babies, but, you know, to see them as people who, you know, deserve to be able to choose what they want and what they need.
And also just to respect and be mindful that they can also change their minds within those decisions.
Yes,
To
definitely.
honor that.
Definitely. Yeah.
Ruth, do you have anything to add, please?
No, it's just really lovely to have you here and to hear your story and to share about your journey. And it's just so wonderful to hear, you know, more about, you know, your philosophy that, well, that underpins everything. And it's just, yeah, I think the families that you are serving are very blessed that you are, yeah, just so open and honoring of their processes. Thank you.
And I love
you.
what you said about the mother supporting a daughter, like that. It opened, having one midwife. I'm sure that you're going to be an inspiration to other midwives out there also feeling, you know, out in the sticks and, you know, is what I'm doing right? And at the end of the day, you've got to work within your comfort zone, and it certainly feels like you have found that for yourself. And yeah, our hope is that you find the support in the community that you need to keep you on that path.
Thank you.
Thank you.
Yeah, thank you.